Good day everyone, I'm Divina Gracia, your student nurse from BSN 1A, and today I will be assessing the brachial artery blood pressure.
Check medical order or nursing care plan for frequency of pulse assessment. More frequent pulse measurement may be appropriate based on nursing judgment. Perform hand hygiene and put PPE if indicated. Identify the patient.
Good morning ma'am, I'm Divina Gracia, your nurse student for today. Can I ask your name ma'am? I'm Aliyah po. How old are you ma'am? 19.
Close curtains around bed and close the door to the room if possible. Discuss the procedure with patient and assess the patient's ability to assist with the procedure.
I am here today ma'am to take your blood pressure and determine whether you have high blood pressure.
Put on gloves as appropriate. Select the appropriate arm for application of the cuff. Have the patient assume a comfortable lying or sitting position with the forearm supported at the level of the heart and the palm of the hand upward. If the measurement is taken in the supine position, support the arm with a pillow. Expose the brachial artery by removing garments or move a sleeve if it's not too tight above the area where the cuff will be placed. Palpate the location of the brachial artery and center the bladder of the cuff over the brachial artery about midway on the arm, so that the lower edge of the cuff is about 2.5 to 5 cm above the inner aspect of the elbow. Line the artery marking on the cuff up with the patient's brachial artery. The tubing should extend from the edge of the cuff near the patient's elbow. Wrap the cuff around the arm smoothly and snugly, and then fasten it. Do not allow any clothing to interfere with the proper placement of the cuff. Check that the needle on the aneroid gauge is within the zero mark. If using a mercury manometer, check to see that the manometer is in the vertical position and that the mercury is within the zero level. Palpate the pulse at the brachial or radial artery by pressing gently with the fingertips. Tighten the screw valve on the air pump. Inflate the cuff while continuing to palpate the artery. Deflate the cuff and wait 1 minute. Assume a position that is no more than 3 feet away from the gauge, and then place the stethoscope earpiece in your ears. Direct the earpiece forward into the canal and not against the ear itself. Place the bell or diaphragm of the stethoscope firmly but as a little pressure as possible over the brachial artery. Do not allow the stethoscope to touch clothing or the cuff. Pump the pressure to 30 mm of mercury above the point at which the systolic pressure was palpated and estimated. Open the valve on the manometer and allow air to escape slowly. Note the point on the gauge at which first faint but clear sound appears that slowly increases in intensity. And then do not reinflate the cuff once the air is being released to check the systolic pressure reading. Note the point at which the sound completely disappears. Allow the remaining air to escape quickly. Repeat any suspicious reading but wait at least 1 minute. Deflate the cuff completely between attempts to check the blood pressure. When measurement is completed, remove the cuff and remove gloves if worn. Cover the patient and help him or her to a position of comfort. Thank you for your cooperation, ma'am. Remove additional PPE and perform hand hygiene. Clean the diaphragm of the stethoscope with the alcohol wipe. Clean and store the manometer according to facility policy. And that's all for blood pressure. Thank you.